Welcome to today's PAFRA Seminar on the Australian Child Maltreatment Study. I'll also just acknowledge the traditional owners of the land from where I am on Meanjin in Brisbane, and I pay my respects to the First Nations owners, their elders, laws, customs and creation spirits, and recognise that these lands have actually always been places of teaching, research and learning. So I'd also like to acknowledge the funders of the Australian Child Maltreatment Study. You might hear me call this the ACMS for short. So there was some NHMRC funding, and then the team and myself have also been successful in receiving 2 lots of additional funding from the Department of Prime Minister and Cabinet, Department of Social Services, to do some scoping work for what comes next after this. Acknowledge our partners, particularly our survey participants and those with lived experience who contributed to the survey development and our knowledge translation strategy, but also those who might be listening in. And of course, our data suggests that this is something that impacts many people. Of course, if this is distressing, feel free to take a break, contact support, or use the ton of support services that you may need to have. I'd also like to acknowledge our whole team, in particular Professor Ben Matthews, who has been our lead investigator here at QUT in spearheading the campaign. And just before I start, I'll mention that all of our major findings have been published, but we're still pumping out a lot of other papers and more work to come. And I've added some additional data on the end of this presentation about corporal punishment. There's a brief report for lay people that can be shared. There's a special edition in the Medical Journal of Australia for those kind of scientifically minded. And there's also a series of infographics and things like that that can be shared for practitioners and participants and so forth. So let me kind of break this down. I'm going to cover off why we did it, what we did, and then what we found, both in terms of the prevalence of child maltreatment and also the impact of that over the course of life. So first of all, it might surprise many people, it certainly surprised me, that Australia didn't have until this study any reliable population level data about the prevalence of maltreatment. So we had good data on how many children were in child protection. We had data, for instance, that Indigenous people are overrepresented in child protection, but we really had no epidemiological data to look at the prevalence or impact of child abuse and neglect in this country. So we didn't know how many people had experienced different types. We didn't know anything about the characteristics, so who's actually perpetrating this abuse, or what are the impacts of this both in young people and over the course of life. And of course, as scientist practitioners, what we want to do is inform policy and practice with research. And it's really impossible to do when we don't have good data to actually base these decisions on. What we wanted to really do was to find out what the evidence was so that we're better able to prevent maltreatment in the first place, reduce the associated health burden with that, and reduce the economic cost to the nation. So this has kind of significant impacts across a variety of sectors, but just to put it in dollar count for people, the Australian Productivity Commission estimated in 2020 that Australia spends it costs Australia $200 to $220 billion per year if you just take into account mental health disorders and suicide. And we know from data overseas that child maltreatment contributes significantly to mental health disorders and suicide. So if we can reduce the moral and the impact on individuals, we can actually have an economic impact as well. There's kind of dual target. So what did we do in the ACMS? This has been published here in the MJA. You can read about it if you're interested in the methodology, and the data will be available for researchers in the next few years. But essentially what we wanted to do was survey random participants. So we wanted to make sure that we were not assessing people that did identify with having child maltreatment, but just random Australians. We used computer-assisted telephone interviewing to collect this sample of 8,500 Australians aged 16 right through to 65 plus. We deliberately assessed or oversampled young people aged 16 to 24. And as I go through the presentation today, you'll see I present the population level data, but also the young people data. And that's because these are the kids that were most recently under 18. And in fact, some of them still are under 18 at the time of the survey. And so that tells us kind of where we're at right now as a nation. In addition, we surveyed 1,000 people in each of 5 age decade strata, and that enabled us to look at what are some of the longer term impacts of maltreatment. We looked at obviously the 5 types of maltreatment, and I'll go through how we operationalise those and what we mean by those in a couple of minutes. We also looked at additional family risk factors and things like the exposure to corporal punishment, sibling bullying and sibling violence, or peer bullying and sibling violence, and then a range of different outcome data. So today I'll be presenting the mental health risk behaviour data, but there's a whole host of other things that we've been interested in. And what this meant is it's one of the most comprehensive surveys globally, because most surveys don't actually assess all 5 types of maltreatment, and most surveys only look at kind of immediate outcomes rather than some of the longer term outcomes. So it's a fairly significant study. As I said, we assessed all 5 types. We were very careful, and we spent really a good 2 years looking at our definitions and mapping conceptually what we meant by child maltreatment. So our measurement is really conservative but rigorous. And this is important because when you get to the data, you'll see that there's quite a lot of people that have experienced this type of maltreatment. So I want to reassure you from the outset that these are really stringent measures. They're not overly inclusive. And it does, as I've said, go beyond all Australian data, which didn't have any, and builds on international data. So now I'm going to go through the 5 types of abuse. So first of all, physical abuse. This is something most people will be familiar with. We had 2 survey items about that being hit, kicked, punched, or physically hurt, beaten up, hit on the face, choked, or burned. So we categorised these as moderate or severe physical abuse. And we counted physical abuse by any other adult. So teachers, clergy, sports coaches, etc. were included. For sexual abuse, we used the Matthews definition for sexual abuse. So contact and non-contact forms of sexual act by an adult or another child. And that's important because a lot of sexual abuse does occur at the hands of other children. To obtain sexual gratification when the child either does not have capacity to give consent, or perhaps may have capacity but did not provide consent. And just to put the kind of sexual abuse questions in context, there were 5 types. We only counted the top 4. We didn't include sexual harassment in our definitions. Looking at or being shown private parts, touching private parts, attempted forced sex or rape, and then forced sex, of course. So the top 3 are the contact abuse. For our young people who, of course, have grown up in the time of the internet, and it's surprising to remember that most of our sample did not actually grow up in the time of internet, we also looked at online sexual victimisation. So this was non-consensual sharing of images or online grooming of adults by adults, and this data is just in the process of publication. Particularly for interest, I think, in PAFRA members and those of us working directly with parents, the concept of emotional abuse is really important. So this, by definition, occurs at the hands of parents. It occurs in a pattern, so it's a repeated pattern that conveys to the child that they're worthless, unloved, unwanted, or only of value in meeting someone else's needs. And this is particularly important because emotional abuse is often not analysed properly, and we've typically tended to undervalue or under-examine this as a research area, particularly in terms of impact. I'll just mention this second one about rejection, just to give you the context. So our rejection item was, did your parent ever tell you they hated you, didn't love you, wished you were dead, or had never been born? So these are not just kind of innocent, was your parent ever a bit mean to you? Some of these are quite confronting items. Keep that in the back of your mind as I'm talking about some of the impacts and the prevalence. Neglect includes a failure of parents to provide appropriate living and emotional resources. We looked at physical neglect, environmental neglect, or medical neglect. And finally, exposure to domestic violence has typically not been assessed as a form of child maltreatment, but it is more recently in the literature considered one of those 5 types. And here we're looking at children witnessing, either by seeing or hearing, violence between their parents or their parent and another romantic partner. So a parent and a boyfriend, or a parent and a girlfriend, for example. Of note, we did not include violence between parents and other siblings in this definition of family and domestic violence, which some studies have assessed. In terms of our outcome measures, we looked at a range of different outcomes, particularly in terms of mental health. We use diagnostic criteria. So this is kind of a big step beyond symptomatology. We were looking at, did people meet criteria for a DSM diagnosis of major depressive disorder over the course of life, generalized anxiety disorder, PTSD, or alcohol use disorder? And of course, the clinical psychs and the social workers amongst us will recognise that I haven't included in here things like eating disorders or personality disorders, which we know are related to child maltreatment. And this is simply because there's relatively lower base rates in the population. So all of our data in terms of mental health outcomes are really an underestimate of real impact in terms of mental health diagnosis. Then we looked at health risk behaviours. So here we looked at tobacco use, so smoking. We looked at subclinical alcohol use, binge drinking and so forth, cannabis dependence, self-harm and suicide attempts, which I'll unpack the impact of that a little bit later. I'm going to kind of try and stream through as fast as I can now through the results. If you have questions, please pop them in the chat. We'll have about 10 minutes at the end to discuss items, but I will warn you, if you haven't seen this data and it has been broadly shared by now, the data are confronting. So please remember that each one of these statistics represents many, many children across Australia, and in fact, many Australians. What we found, much to the shock of our team and perhaps many researchers, is that most Australians have experienced at least one form of child maltreatment. So 62%, 6 in 10 Australians have reported experiencing one of those 5 types: physical abuse, sexual abuse, etc. Even worse for women, they were much more likely to have experienced any type of maltreatment than males, but even males, we're looking at about 6%, 6 in 10. So these are very high numbers. And in fact, I would argue this suggests that it's actually normative in the Australian culture, and we need to be doing much more than we should be about it. When we break down the different types of maltreatment that people have experienced, we find that on average, most types, physical abuse, sexual abuse, and emotional abuse, are sitting at around 30%. So this is the data from the whole population, 16 through to 65 plus. A big standout there on the very far right is exposure to domestic violence. So keep in mind, this has not been assessed in Australia, and there's lots of research going on to family violence at the moment. At Australian population level, we found about 40% of Australians have experienced exposure to domestic violence in childhood before they turned 18. And the lowest number consistent with child protection data is neglect. We also found kind of strong gender effects here in terms of the types of abuse that individuals have experienced. And this data just presents women and men, but we actually did also assess gender diverse participants. That those 2 papers for that actually at the moment are under review, but the data for them was suggested that it's even worse than for women. So overall, there were similar rates of physical abuse and EDV between men and women, but women had much higher rates of sexual abuse, much higher rates of emotional abuse, and also higher rates of neglect. So there's certainly something going on, that there's a strong gender issue in terms of exposure to maltreatment. This is the data for our young people, so 16 to 24. And in particular, what I will draw your attention to is the increased rates of emotional abuse and EDV. So the ACMS was a cross-sectional survey. We can't argue there's definitely an increase, but certainly the pattern of results suggests that things are going up. So when you compare young people to the whole population, the rates of emotional abuse are much higher. So almost 35% of young people are reporting experiences of emotional abuse. I'll go back to that sample question that I said before about, did your parent ever tell you that they hated you, wished you were dead? About 10% of Australian young people said that had happened to them. So this is, again, not just, was your parent ever mean? Did they call you a little so-and-so? This is a pattern of repeated exposure to violent insults, languages to children that conveys to the message that they're not important or worthwhile. Another very stark finding for our young people is that exposure to domestic violence has gone up. relatively dramatically compared to the whole sample. So 39% in the whole sample, right up to about 44% in our young people. So these are really points of opportunity for us to make a difference and to do something. And for parenting researchers in particular, EDV and emotional abuse are things that are occurring in the home, typically at the hands of parents or exposed to by parents. So for us as family researchers, this is a huge opportunity for making a difference, and something we need to do something about. There is a little bit of good news in terms of sexual abuse and some slight reductions potentially in physical violence that I'll talk about a little bit later. A similar pattern here for young people in terms of gender effects. So women are much, much more likely in that 16 to 24 group to be experiencing sexual abuse, and particularly to be experiencing sexual abuse at the hands of other teens or other children under 18. So I'll cover that off a little bit later, but also much more likely to be experiencing emotional abuse. So emotional abuse and sexual abuse, clearly kind of really big ticket items for something we need to do something about, but also for exposure to family violence or domestic and family violence between parents. We wanted to make sure that we were not capturing maltreatment episodes that were isolated. So we looked at the chronicity of these different types of maltreatment for all of these. So physical abuse, sexual abuse, and EDV, we were able to count the individual instances. And most people, as you can see in this data, reported that it had happened more than once. And in fact, 20% of people for physical abuse reported that it happened more than 50 times. For sexual abuse, 78% saying it happened more than once, and 11% saying it happened more than 50 times. So clearly a pattern that these things are occurring repeatedly. They're not isolated instances that we could perhaps put down to an anomaly. These are really the patterns in these children's lives. Emotional abuse and neglect, we asked about, did this occur over a period of days, weeks, months, or years? And overwhelmingly, people were saying this occurred over a period of years. What we suspect is that it's probably going in and out. There are times in a parent's life where they might be more vulnerable to stress and more likely to engage in particular behaviours. So it's not saying it's happened from the time they're born right up to 18, but there certainly are periods of time that it's occurring fairly consistently. Another key finding is that most people that have experienced any child maltreatment are actually more likely to have experienced what we call multi-type maltreatment. So this is the presence of more than one different type of maltreatment. So across here, we can see the data for young people, 16 to 24, 2 in 5 of our young Australians, 16 to 24, have experienced more than one type of maltreatment. Remember, 62% have experienced any maltreatment, 40% overall of the sample have experienced multi-type maltreatment. That's actually the highest of either single type or no maltreatment at all. So about 1 in 4 have experienced 3 to 5 types. We call this severe multi-type treatment. And probably that's linked with the worst outcomes. This is a beautiful paper by Daryl Higgins, who's also a PAFRA member, if you're interested in this prevalence of multi-type. But this is really a key area of research because we need to stop thinking about maltreatment occurring in isolation. This graph is kind of complex, but really all I want you to take away from it is it maps on all of the different unique types. So this big pink, can anybody see my pointer? I don't know if you can see this, no. But the big pink circle at the bottom is the prevalence of EDV, so 39% of the population. Mostly that's occurring alongside other forms of maltreatment. In comparison, emotional abuse, so the big green circle you can see is nearly always occurring with other types of maltreatment. So only in 2.6% of the sample did we find emotional abuse without the presence of at least 1 or 2 other forms of maltreatment. So really what we're seeing is those kids that are experiencing maltreatment are much more likely to be experiencing multiple types, some potentially at home, some from other settings. But certainly we can't think about these maltreatment types in isolation. We need to be looking at what's the pattern of things. And for anyone that's a clinician, if you're hearing clients saying, I experienced sexual abuse, that's a warning to us to think, well, what else was going on in your life? What else were you more likely to experience? Because the data suggests that most people that experienced any type did experience more than one type. What we also found, and this will come as no surprise to PAFRA members and potentially those of us that are working with family and children, is that all types of family adversity really increased the risk of multi-type maltreatment. So we haven't looked at this in isolation, but we have looked at it in multi-type. And pretty much any of these kind of common ACEs that people would think about, parental separation, parental illness, and so forth, is increasing your risk of multi-type maltreatment, so doubling them basically. And what this tells us is that there is a lot that family researchers can do in supporting families to prevent the impact of some of these early ACEs or family-related ACEs developing into multi-type maltreatment. So we need to kind of be thinking about what additional types of social policy changes might need to be occurring, what additional sorts of supports family might be needing, rather than waiting until abuse is actually occurring. There is some good news. So we have in recent years seen a decline or a potential decline in physical abuse. So if you're thinking about looking across this age group at the bottom, we see 65 plus, right down to 16 to 24-year-olds at the other side. And our 16 to 24-year-olds report the lowest rates of physical abuse compared to those older age groups. And this really tells us that if you intervene, you can actually make a difference and see some change. Another huge area that we've seen significant change in reductions of child sexual abuse is in relation to family sexual abuse. So this has been a target for government and has been successful, or suspected successful. We're seeing much lower rates of abuse by family members, 4.4 down from kind of 9.4 at the highest group of 45 to 54-year-olds. So that's kind of useful, a cautiously optimistic story, but of course we don't know that these family perpetrators who would historically have perpetrated sexual abuse on their own children or in their own family have not just moved to potentially online sources of child victimization or other things. So there's certainly positive news here, but by no means does this mean we can rest on our laurels. Also, just a quick comment about the classes of abuse. So this data is based on these percentages are based on the whole sample, so 100%, of which 28% have experienced any child sexual abuse. The key takeaway here is that 12.9% of Australians have experienced sexual abuse at the hands of other adolescents, so under 18. So this might be siblings, but it probably is most commonly other children that these young people are involved with, so ex-boyfriends, ex-girlfriends, other people at parties and things like that. So we really need to kind of change our messaging about child sexual abuse. This is not things that are happening by people in vans giving out lollies. This is really happening in our schools, in children's worlds, in their parties and things like that. And there's a lot that we can do about that, which is a good opportunity for intervention. The bad news is when we look at this over the whole sample, so we're comparing, this first column is the whole sample, so right through to 65 plus, and then we're looking at the young people in the next sample in gender. We're seeing in particular for young women, 16 to 24, one of the most common categories of perpetration of child sexual abuse was another adolescent that the victim knew, but were not former or current romantic partners. So these are people that they can identify that potentially clearly they were not engaging in consensual interactions with, but had been reporting it, and 9% reporting, particularly for females, current or former romantic partner sexual abuse. We don't see this same pattern for males. So certainly, again, we have this whammy for females and women reporting the highest level of sexual abuse, but also the highest level of child sexual abuse by known and adolescents and former and current romantic partners. So in the context of the consent matters rules and the things that are coming out in the literature and the media about that, that's really important takeaway message. This data just breaks down the child sexual abuse in the youth sample, so 16 to 24, 1 in 4 had experienced child sexual abuse. And this data along the bottom is really particularly concerning. So 15% have experienced attempted forced sex and almost 9% have experienced unwanted forced sex rape. These are not insignificant numbers. And when you think about 9% of young people 16 to 24, that is a lot of children across the Australian population. So that kind of brings me to the end of the basic prevalence data. As I've mentioned, that data has been published and you can read more about that or on our website or in our report or in the scientific papers. Now I'm going to kind of move on to what is the impact of these experiences on mental health outcomes and then on health risk behaviours. And of course, part of the quality assurance, I suppose, of looking at are these high numbers, is 6 in 10 people an overestimate, is what is the associated outcomes. And here we see really strong data that the prevalence or the experiences of child maltreatment is highly related to mental health outcomes. What we found was 1 in 2 Australians who had experienced any form of child maltreatment reported one of those 4 common mental health disorders at a diagnostic level. 1 in 2. In comparison, there was a subset of people who did not experience child maltreatment who still developed a mental health disorder, one of those common ones. We know that there are multiple factors that contribute to development of mental health disorders, but clearly when you're looking at this disparity, there's a fairly significant impact in terms of child maltreatment. We are looking at some of the impact of that in terms of burden of disease and how much we can separate that out. Here we have the data of the different types of mental health disorders. So the red bars represent those that have experienced any maltreatment that also meet the criteria for the mental health disorder underneath. So 24%, 25% of those who experienced child maltreatment had major depressive disorder, 16% reported generalized anxiety disorder. Severe alcohol use disorder is the kind of lowest association, but still highly associated. And then PTSD, of course. What this tells us is that child maltreatment, perhaps not surprising to anybody, does dramatically increase the risk of experiencing one of these mental health disorders. And conversely, not experiencing them actually reduces the risk. So there's a lot that we can do to try and mitigate the impact of the development of mental health disorders in this country by reducing child maltreatment. This is another way to kind of present the data, and I'm not sure who knows or who's familiar with odds ratios. So I'm just going to give you a brief summary. An odds ratio is just a measure of association. So the higher the odds ratio, the higher the association, or the higher the strength of the association between exposure to an event, in this case child maltreatment, and the development of the outcome, in this case one of the mental health disorders. Anything above a 1 is considered to be significant in terms of increased odds of developing that thing. So here we see every single one of our mental health disorders that we assessed was associated in the yellow bars with an increased risk of that mental health disorder. So people who have experienced child maltreatment are 2.8 times more likely to develop any mental health disorder. Reading down in the yellow, they're 4.6 times more likely to develop PTSD, 3.14 times more likely to develop generalized anxiety, and so forth. The other thing that you'll notice is that both the blue column men and the pinker coral column women are reporting significant associations, but women are reporting much higher associations. So I said earlier that women are reporting higher levels of different types of maltreatment, but here we're looking at even controlling for the experiences of maltreatment. Women seem to be getting a double whammy, so they get more likely to experience it, but even adjusting for that, they're more likely to have negative outcomes in terms of mental health. And again, this doesn't capture any of those kind of subclinical thresholds or any of the more extreme psychiatric diagnoses that we didn't assess, like personality disorders, which would probably be even higher. This is the prevalence data for young people in terms of gender. So here you can see the males, the green is people without child maltreatment or males without child maltreatment, and the red is with child maltreatment. And pretty much we can just see here in every single disorder for both women and men, they're much more likely to have that disorder if they've experienced maltreatment, which is what we just reported in the odds ratios. But the numbers, sometimes these bars are kind of quite stark when you look at the impact of that. One thing that was really exciting for us in a kind of nerdy statistics way was to look at, can we partial out the unique influence of different types of maltreatment? So I said earlier that most people, about 40% of the Australian population have experienced multi-type. And there's relatively little data on which ones of these are worse in terms of mental health impacts or other health impacts. So these odds ratios look at the impact of particular types of maltreatment. So SA stands for sexual abuse and EA here stands for emotional abuse, after fully adjusting for other confounds like age and things like that, but also the experience of other types of maltreatment. So this tells us what is the unique influence of sexual abuse on PTSD, even if you adjust or had control for not any other types of maltreatment. And here is one of the really key findings of the ACMS, and it's a really important finding for family researchers. And that is that sexual abuse and emotional abuse are consistently the types of maltreatment that are associated with poor outcomes. As I've said, we're doing kind of quite a lot with sexual abuse prevention in Australia, and there's a new campaign that's been funded by the Australian government at the moment, One Talk at a Time. I encourage you to look that up. But we are doing relatively nothing about emotional abuse. And what these data tells us is that someone who's experienced sexual abuse, even accounting for everything else, is almost twice as likely to experience PTSD, and the same for emotional abuse. With generalized anxiety, the findings are even starker for emotional abuse, so 2.13 times more likely to develop generalized anxiety compared to someone who did not experience emotional abuse. We didn't find that pattern for severe alcohol use disorder, probably because it was mostly driven by men, but certainly sexual abuse and alcohol use disorder is clearly related. And same thing for depression. So here again, emotional abuse being the driving force behind some of these negative outcomes in terms of major depressive disorder. And again, this is just accounting for all of those other things. If you look at just the individual odds ratios, without adjusting for that other maltreatment, they're even higher, 8-9 times more likely to experience major depression if you've experienced any emotional abuse. So these conservative estimates tell us that we have a long way to go in terms of dealing with and preventing emotional abuse at the hands of parents. So hopefully this is a call for all of us on this call to action. So now let's think about the impact of this on associated health risk behaviours. Really, we see a similar pattern. So we assessed 6 types of health risk behaviours. Just to refresh your memory, these are down the side: smoking, cannabis dependence, self-harm, and suicide. And all of these were significantly related to the prevalence of child maltreatment. So you can see here's the data on did they experience maltreatment, yes or no. Twice as likely to report smoking if they've experienced maltreatment, 4 times more likely to experience self-harm, and so forth. But these odds ratios are particularly concerning. So 6.2 times more likely to be cannabis dependent if you've experienced self-harm, 4 times more likely pretty much to experience prior year self-harm, and 4.5 times more likely to have attempted suicide in the past year. This is across the whole population, but when we break it down into age groups, what we found is we could not find any older Australians, so 45 plus, who were cannabis dependent or were still self-harming or still attempting suicide, who did not experience any type of child maltreatment. So this tells us that these relationships develop early. We see them in the youth sample very, very clearly, but we also see them right across the lifespan. So the impact of maltreatment, as many of us would know from clinical work, doesn't abate when childhood ends. It continues over the course of the lifespan, which of course adds up to significant personal cost and significant economic cost in terms of health service use and so forth. This is the data for the young people. So men and women, same kind of pattern here right across the board. Women for all of these mental health, these health risk behaviours are much more likely to be reporting them if they've experienced child maltreatment. In particular, I'll draw your attention to the suicide and self-harm. So in young people, 16 to 24, if those present, this is not even presenting with suicide, but certainly if they are presenting with suicide attempts, we could not find any people in our sample who had reported past year suicide attempts as a woman that did not have a history of child maltreatment. Very low numbers for men as well in that same kind of suicide attempt. Similar patterns for self-harm, obesity, and so forth. The only one of these that's not significant is young Australian males binge drinking. There's actually no significant association for men in the 16 to 24-year age group. And we suspect that's probably because binge drinking in young men is unfortunately very, very common, irrespective of personal adversity history. I talked before about the importance of controlling for other types of maltreatment, and this is the same data but for health risks, and we see the same pattern of results. So the experience of sexual abuse and emotional abuse are particularly harmful in terms of self-harm and also in terms of suicide attempts. And of course, remember that sexual abuse and emotional abuse are much more likely to occur in women. And same thing for cannabis dependence. So really, there's a very clear message. If we want to reduce the mental health burden, if we want to reduce the associated burden of health risks, we need to do something particularly about sexual abuse and emotional abuse. Of course, we need to reduce all types. I'm not at all suggesting we ignore the others, but if we want to think about return on investment for research and practice, this is an opportunity to make a real difference. We also looked at health service use, and this is the kind of last key big finding of the study in the MJA article. So this is looking at the prevalence or the odds ratios of health service use. So going to see a GP, going to see getting admitted to hospital and so forth. And pretty much we found there was really nice, clear patterns of relationship here. So not only do people that have experienced maltreatment, are they more likely to experience mental health disorders and health risk behaviours, they're also a higher drain on our health burden system. So the 1.4 times more likely to be admitted to hospital, 2.5 times more likely to be admitted to hospital for a mental health issue, 2.4 times more likely to have had at least 6 visits to the GP in the last year, and 2.3 times more likely to have had 24 visits to a practitioner in the last year. And for psychs and psychiatrists, we also found that same pattern. So I think they're about 2.5 times to 3 times more likely to have seen a psychologist or a psychiatrist in the last year. So we need to really be thinking about prevention. And, you know, for many of the people on this call, I know that that's something that's close to our hearts. But as long as we're only investing in the hard end of cases, if we're only investing when people are already presenting with mental health problems or already presenting with health behaviours, we've really missed part of the opportunity to make a big difference. So we need a paradigm shift to reduce and respond to maltreatment as early as possible, ideally in preventing it, because of these longer term impacts, both the personal costs, but also the costs for our nation. Got about 7 minutes left, and I'm trying to fly through as much data as I have. For those of you that have heard about the ACMS data before, this next section will be new, and I just wanted to kind of put it in this section, particularly because I know PAFRA people subscribing to the PAFRA group will be interested in physical punishment, but also because we as a PAFRA group are working on a campaign to overturn the laws permitting physical punishment in Australia. So I'm talking about smacking and corporal punishment. So if you're interested in that, please contact me or Sophie Havikhurst or Daryl Higgins, who are also PAFRA members, to join our group. In the ACMS, we did not conceptualise physical punishment as a type of maltreatment. In the broader literature, there are some people that are pushing that, and certainly people have actively called for the experience of corporal punishment or physical punishment to be considered an adverse childhood experience. There is strong data that suggests experience of corporal punishment is linked with higher risk of other forms of maltreatment, so there's certainly some overlap there. So what we wanted to do in this paper, and it will be out, I think, maybe tomorrow or early next week. So please don't share these slides on any social media this week if you wouldn't mind. But we wanted to see how many people have experienced different types of physical punishment. And what we found was that 6 in 10, same number that have experienced any type of maltreatment, have experienced at least 4 or more occurrences of physical punishment. So we asked them, did an adult ever smack you or physically punish you to discipline you for your misbehaviour? We found some good data about changing patterns, potentially. I'm going to present that in a moment. But we also asked parents, so those that identified as parents, if they had ever used it and how often they had used it. And we found about 1 in 2, 53.7% had reported the use of physical punishment on their children or children in their care. Finally, we asked all Australians, but also parents, if they believe that physical punishment is necessary. And I think concerningly, about a quarter of Australians said that they do think it's necessary, or at least, I think I asked my dad about it last night. Do you think we should hit kids? And he said no, but some kids need it, which I think captures the thinking of a lot of older Australians. But the good news is that most Australians, 3/4 of them, do not believe that physical punishment is necessary. So we might be seeing some changing norms in terms of attitudes about that. This data kind of breaks down the use of corporal punishment. And for me, this was super reassuring. And Sophie has led a paper on a call by PAFRA members and a number of other people from our End Corporal Punishment campaign about calling for legislative reform. And this data kind of shows you the changing reports by age group. So across the bottom, you have that 65 through to 16 to 24, and you see a really nice clear decline. The yellow line there is overall at a population level, and then you've got mothers in the purple colour and fathers in the blue. But overall, we're finding people are reporting much less use of corporal punishment the younger they are. So there seems to be some generational patterns of change in terms of the use of corporal punishment. And just to give you the data for the 65 plus, 64% said they have used it. When we're looking at 16 to 24-year-olds, only 14.4 have reported using it. So that's really promising news, I think, for generational change in terms of parents' use of corporal punishment. We also looked at community level beliefs about corporal punishment, and overall we see that same kind of general downward decline in terms of community beliefs for the need for it. So older Australians, 65 plus, on the kind of left end of your screen, you can see are much more likely to believe it's necessary. About 38% of the older cohort said corporal punishment is necessary or physical punishment is necessary, but only 14.8%, 15% of the youngest cohort said that it's necessary. So clearly we're seeing a really change in patterns overall. The other thing that astute observers might notice is that there is a line there for non-parents and for parents. And I was having a discussion when we're doing this data about what would parents say. Would parents think it was less likely or more likely that it's needed? And I was like, I think parents will think it's less necessary because they don't want to see their kids hit. But we found the exact opposite. So parents were actually saying, I think it's more likely, particularly modern younger parents, it's more likely than non-parents. So non-parents are saying, no, it's not okay to be violent towards children. It's against the UN criteria. It's against all these kind of public calls by paediatric associations, Australian medical associations, and so forth. But still about 30% of parents are saying, yeah, I think it's probably needed some of the time. So room for movement there, both in terms of community attitudes, but also potentially in law reform. So just to summarise the key findings overall, unfortunately, child maltreatment is endemic in Australia, particularly multi-type maltreatment. It's still occurring to young people today, and that seems to be a very strong gender effect. So women are much more likely to experience particular types of maltreatment, but also more likely to be adversely affected by the experience of maltreatment. And the health impacts in terms of mental health and health risk behaviours occur early and are sustained right across life. And new today for PAFRA people, corporal punishment is still too common, but does seem to be declining. So that's some positive news. So what do we need to do from here? Certainly read about this in our report in more detail, but particularly I think we need a coordinated approach across government. So we need to get governments to invest in prevention. We need policy change. We need community level and sector support, but also particularly focusing on parenting support. So 3 of those major types of maltreatment are occurring by parents: neglect, exposure to domestic violence, and emotional abuse. So we need to invest in prevention, parenting services, as well as some of the more tertiary things, and also an emotional revolution and a sexual and relational revolution to change the respect that women particularly are given, and gender diverse people as well. This is my last slide, then I'm going to open it up to questions. So if you haven't popped questions in the chat, or you have them, now's the time to think about those. I would argue that the data provides a very, very strong rationale for increased investment in family support. So really there's no argument that we need to be investing in families, and we need to be investing in families earlier. Particularly, we need to be investing in emotional abuse, and there is relatively no interventions that specifically target emotional abuse. Some of us are working on this at the moment, but that's a really big, important area for us to kind of think about. And also the role of protective factors has been underexplored. So I've kind of presented the population level data, but some children that have experienced mental health disorders, about 1 in 2 child maltreatment, don't develop these mental health disorders. And so we don't know a lot about why some children are experiencing worse mental health outcomes and health risk behaviours and others don't. Is it that it's occurring by the hands of certain people but not other people? Is it other resilience and protective factors? And I would argue that the family role has a lot to play in terms of protective factors. The government has invested a reasonable amount of money in planning a wave 2 ACMS, and so we've been working on that this year, and part of that will be about this protective kind of factors. And also, of course, corporal punishment is still a very common form of violence in Australia, so there's some promising trends, but we need to do more about that. So hopefully this will bring some issues to the forefront and get you thinking about some of these data and where we go with that. So if you're interested in more, please check out our website or connect with me on one of the social platforms. But other than that, I'm going to end there and open up to questions. I can see the first question is in there from Jenny. Does the data come from hospital admissions, schools, or multiple sources? Jenny, we actually asked people themselves. So these are direct from the people who've experienced maltreatment, and that's why it's so important, because historically we only had data from hospital sources and things like that. So this is direct from people. What did you experience? What's the impact of this on you now? Otherwise, I've been told 10 minutes for questions. So other questions, comments, feel free to pop your video on or demute or pop them in the chat.
Bessie, feel free to unmute yourself if you'd like to ask a question.
Hey, Dave, that was a fantastic presentation. Well, I don't know if fantastic is the correct word to describe those results, but you know what I'm getting at there. I'm really curious about you and your team's hypotheses about the really startling impact of emotional abuse on mental health outcomes, and why it was emotional abuse out of the other types of form of maltreatment that really stood out as having that biggest mental health impact.
Yeah, we didn't have hypotheses about them. We were just kind of exploring. Our team includes a number of psychologists and also psychiatrists, and we would argue that it probably impacts the attachment and the kind of relational formation. So when these primary attachment figures, your mum or your dad, is telling you that you're worthless, children tend to kind of believe these things. And I think what's happening is you're kind of developing a sense of I'm not worthwhile, and then people tend to engage in kind of more maladaptive practices across life, which kind of cascade. So you see this kind of early epigenetic aging from occurring. You see kind of changes in the way that people develop themselves, and then, in fact, the way that they react with other people. So there's data from LSAC that's just come out a couple of weeks ago. I think I mentioned this already separately to you, Cassie, that showed that parenting relationships actually protect against intimate partner violence. And so I think it's that primary parent-child relationship that tells children what they're worth and where they go from there. So I think we need to unpack the mechanisms in a bit more detail, but from a psychological point of view, it seems pretty clear. Whereas if you don't have that, and certainly people talking to us will say, yes, my mum and dad hit me, but I knew that they always loved me and I knew I was always important. And particularly in some cultures, you see that kind of pattern. So I think it's that sense of, am I important? Kath has asked a comment, was it derived from equal sections of the population? Yes, we have balanced our sample across Australian census data and also across National Health Survey data. So we know it is representative of the population at large. And we did include representative numbers of Indigenous people as well, but we haven't reported that separately for a variety of ethical and moral reasons. You're welcome. Heather.
Jenny, feel free to unmute yourself.
Yes, so Davina, you said you spoke to individuals. So I'm just interested, how did that process come apart? Where did you find them? The interview, how it actually came about. Thank you.
Sure. So what we did was we worked with a survey company, the Social Research Centre, which is affiliated with one of the universities, and we basically just cold called Australians across the group. And when we hit our kind of target for 1,000 people in this age group, we stopped accepting those people. We sent an advanced text message to kind of random numbers that were generated from a computer to say, we're going to invite you to this study. Here's a link to our website. And then we just kept calling them until we either got them or we'd hit nine times. And thankfully, a lot of people said that they were happy to participate. And so that's where we kind of got them. So they did it all on the telephone through kind of data collected immediately online. Once they'd been contacted and they said they were happy to do it, they could either do it straight away or they could book a time. So thank you to all of those 8,500 people who gave up half an hour of their time.
Thanks, Davina. Thank you.
You're welcome.
Can I ask on that note, Divna, thank you. That was really well presented too. Was there, I'm just wondering about, the people that you were doing the interviewing and what protocols that they might have had in terms of like participant distress or what safety was around that. We're asking about this, which is obviously, I mean, I agree, it's just very generous of people to share this, but it's also hard, I imagine, as well. Yeah.
That's a great question, Lara. Thank you, and nice to connect. I see your name around a lot, but I don't think we've ever met. So I worked closely with James Scott, who's a child psychiatrist, to develop the protocol. So we had a distress management protocol for every participant. So what interviewers should do if somebody experienced any distress, right up to severe distress, including contacting police and ambulance and those kind of things. We also had a red flag protocol for young people. So, we surveyed 16 to 24-year-olds. So young people that were 16 or 17 who reported experiencing maltreatment in the last year were assessed separately. So I called each of those people to make sure that they were still safe. Had they received support? Did they need support and things like that? So there's a whole host of those two distress protocols. Some of that is outlined in my methodology paper, but I'm also working on a paper outlining those two processes in more detail if you're interested in that.
Yeah, great.
It'll be out early next year.
Awesome.
But yeah, it is. And interestingly, when I called those kids that had experienced abuse, like it was quite distressing. I'm in a clinical psychology, I've done trauma psychology, I've done a lot of stuff. But when I saw on paper, here's a child, they're 17, this is what they've experienced. So I would see, emotional abuse by mum or sexual abuse by uncle. And you look at it on paper and you're like, oh my gosh, these poor children. But they are so resilient. And I spoke to them just off the cuff about what was this survey process like? And, we did some pilot work as well that I haven't kind of talked about, and assessing how distressing it was and things. But overwhelmingly, they were all like, I'm so glad you're doing this. Thank you for giving us the chance to participate. Thank you for listening to us. If there's anything else we can do, please get in touch. So it was really, really heartening to see how grateful they were, because often you think, how do I get people? But these were just like, oh, what else can I do? And then I'd have people calling up saying, can I participate? And of course they can't because it's random. But the process did not seem to be very distressing for some people. The distress that they did experience was transient. And I think that's because most of these people have told their story to lots of people. And reassuringly, most of them were already getting some sort of support or had been moved from that unsafe family situation. Yeah, but thank you for raising that. I didn't mention that. It's an important thing to do. Any final questions?
If no one has any further questions, I'd like to invite you all to thank Divna so much for her time and her incredible work in this field. It is such an important and insightful work you've done so far, and I'm looking forward to seeing your paper that you were speaking of and all the work to come. So thank you so much again for your time today. And everyone, please do look out for the paper that Divna was mentioning that should hopefully be out by sometime next week. And also this recording will be available in roughly a week's time on the PAFRA website, and also our YouTube channel. But thank you again, all of the attendees who have joined us for the PAFRA Seminar series through 2023. Please have a safe and happy holiday period, and we look forward to seeing you all in the new year for our next installation.
Thank you, everyone.